Hello, and thank you for your time today. As the 52nd president of the Society of Gynecologic Oncology, I'm truly honored to represent all of you and our subspecialty during the months to come. These are challenging times for healthcare practitioners and for our nation as a whole. The COVID-19 pandemic has exposed and confirmed glaring healthcare disparities in our most vulnerable populations, with these systemic health inequities impacting our gynecologic cancer patients, their caregivers, and our providers. I'm personally horrified by the continued police violence against our Black community and the individual and systemic racism that exists in our country. In our commitment to health and well-being of our patients, our members, and our staff, we must face head-on these disparities and inequities that are based on race, ethnicity, sexual orientation, gender identity, and socioeconomic status. I want to reiterate SGO's total commitment against racism and to the value of diversity and inclusion. There's certainly much work to be done, and we can all play a part in bringing about positive change. By being the trusted source for education and information related to gynecologic cancers, SGO's leadership is acutely aware of the responsibility that we have to our members and to our patients. Gynecologic cancer patients rely on the Foundation for Women's Cancer to provide the most up-to-date and accurate information about their diagnosis. This includes educational resources like brochures and webinars, and in the not-too-distant future, a return to our gynecologic cancer education courses for survivors and their caregivers. For our SGO members, we realize that scientific meetings are a key and critical benefit for delivering both education and networking opportunities. Clearly, it was an unprecedented but totally necessary move to cancel the SGO annual meeting on women's cancer earlier this year in Toronto. The SGO immediate past president, Dr. Warner Huh, and our scientific co-chairs, Dr. Katie Moore and Dr. Kenny Kim, worked closely with SGO staff to transform this Toronto meeting into a really fabulous series of live webinars that are currently available on demand. The success of our virtual annual meeting gives us a new opportunity to explore even more e-learning possibilities going forward. While the remainder of our SGO 2020 live events are all being transitioned to this virtual platform, we're closely monitoring the COVID-19 situation as it applies to the SGO 2021 meetings, including the winter meeting and the March annual meeting on women's cancer. We must prepare for the likelihood that these planned live events will require an e-learning component, but we also must be prepared for the reality that we could even need to again conduct these meetings entirely virtually. Either way, we're prepared to provide the excellent education that you've come to expect from the SGO that provides both value to your patients and value to your practices. Another thing that long-term members have come to rely upon for their departments and institutions is the SGO Practice Survey. Every 5 years, we make an assessment of the gynecologic cancer subspecialty. The data collected gives us a baseline for many issues that members really care about, so that the SGO can help through their committees to make improvements that will enhance our practice environments and ultimately benefit our patients. I certainly hope that you'll be able to join us for the upcoming Member Forum webinar called The Big Reveal 2020 State of the Society Survey. This webinar is scheduled to be held on Thursday, June 25th at 7 p.m. Central Time. Details about the webinar and a registration link have been sent by email and included both in SGO Issues and Women's Cancer News. I look forward to hearing from our members, Drs. Barbara Goff and Dr. David Kushner, as they discuss how the top findings from the survey translate into valuable practice implications. In addition to the survey, SGO leadership also understands that having easy access to gynecologic cancer resources is an important membership benefit. Last week, we launched the new SGO.org website with a sleek and modern design. I assure you the new website is much easier to navigate than the previous one, and it's loaded with resources that you can search by type and by topic. As an SGO member, you can use the same credentials as before to access tools like the Member Directory, SGO Connected, the Career Center, as well as the journal Gynecologic Oncology. It's safe to say that all of us will remember the events of 2020 for years to come. While our eyes have been opened to a new reality, we can also identify new possibilities. That's why I'm optimistic about the future of our profession and the future of the SGO. I am truly honored to serve you, and I look forward to this journey together during this year. Thank you, everyone, and be well.